several options for hip pain and hip arthritis, and hip replacement is obviously the last option. That's when all the conservative measures don't help. Conservative measures being simple things like exercise, anti-inflammatories, weight loss, all the things. These are common sense things I think most people know and realize by the time they see me. Other options to consider would be sometimes we can do a cortisone injection of the hip. And then the last option, if all of those things haven't helped, it would be a hip replacement surgery. And patients oftentimes ask me, when should I have a hip replacement? And basically the way I answer that is your hip will tell you when it's time to do that. And when it's time in general is when your hip hurts a lot, and B, when all those other things I just mentioned are no longer helping. Everybody has a different pain threshold. Every patient has a different threshold of pain, of what's acceptable to them, what they can live with and what they can't live with. I think statistics show that men do tend to be more likely to have surgery than women in the case of hip and knee replacements. So what I tell people is, if your orthopedic surgeon tells you you have hip arthritis or knee arthritis, then and a hip replacement or a knee replacement is an option. Whether to do that isn't for us, the orthopedic surgeon, to tell you, the patient, that you need this done. It's for your knee or hip to tell you. Your hip, I tell patients all the time, your hip will tell you when it's time for that step.